Often misunderstood and misdiagnosed, narcolepsy impacts a person's daily functioning and social well-being. In other words, it's a burden. And here to discuss is Director of the Sleep-Wake Disorders Center, Dr. Michael Thorpe, and Jessica, who actually lives with narcolepsy. Thanks to both of you for joining me.
Thank
you. Thank you for having us.
So Dr. Thorpe, we'll get a little more information about this disorder in just a little bit, but Jessica, starting with you first, give us an idea of what your journey has been to a narcolepsy diagnosis.
Sure. So I first started experiencing my symptoms when I was 18, and I was going to college. I always assumed that it was normal to feel sleepy if you were a busy student. So I didn't realize that my symptoms were actually those of a neurological condition. And it wasn't until about 8 years after I started experiencing the symptoms that I was formally diagnosed with narcolepsy after a sleep study.
Speak about the impact that it has on your life, not only, socially, but maybe physically and emotionally.
Sure. So as Dr. Thorpe can explain, I am one of the people with narcolepsy who experiences a muscle weakness that's brought on by high emotion, so it's called Cataplexy. So it does make you avoid emotional situations or instances where you might be surprised or stressed. And also, I feel sleepy all the time, every day, even with treatment. So it becomes difficult to juggle the different parts of my life with this condition.
Well, thank you for sharing your story with us. I know it's a very personal thing to come out and share your medical stuff with the public. But, Doctor, from a medical standpoint, can you explain what narcolepsy is? Because I don't think many people can really grasp what it is.
Well, that's right. Most people do not understand narcolepsy. Narcolepsy is a lifelong, incurable disorder. And the main features of it are, as Jessica has mentioned, tiredness and sleepiness during the daytime. That's unrelenting. It's present every day. In addition to that, there can be weakness that causes patients to fall to the ground or drop things. And there's also disturbed sleep at night with vivid hallucinations and nightmares and frightening paralysis that occurs as patients are falling asleep at night. So it's a very disruptive disorder that affects not only nighttime sleep, but also affects during the day with the sleepiness and the muscle weakness.
And Jessica mentioned cataplexy. This is when emotions trigger the symptoms of narcolepsy. How is that diagnosed? How is it triggered, etc.?
Well, that's right. Cataplexy can be difficult to diagnose, and in our survey that we did, most physicians found that it was difficult to diagnose narcolepsy because the symptoms can be quite subtle at times, but very disabling for the patient. But typically, if they get emotional, they may get a weakness in the legs that causes them to fall to the ground, or they may catch their toe and stumble. If they're holding something, they'll get a weakness causing them to drop it. If they're talking, their head may fall forward and they may get some slurring of speech. So very disabling symptoms, and it takes some acumen to get to an accurate diagnosis.
And a question, excuse me, a question that may be on people's minds is, how do I differentiate between just plain being tired and narcolepsy? Because some of us might wake up on a Monday morning and think, I may be narcoleptic, this is terrible. But there's a real difference, right?
Oh, yeah, there's a difference. I mean, patients with narcolepsy are tired and fatigued all day long. So even if they have a nap, they may be helped and refreshed for a few minutes, but then the sleepiness comes back again. And it doesn't go away if they go on vacation or if they have 8 or 9 or 10 hours of sleep at night. They're still sleepy during the daytime. So that differentiates it from other causes of sleepiness.
Very important information from both of you. Of course, it's important to know all of this for those who didn't really have an idea of what it was. So thanks for your time today.
Good. Thank you.
We'll be right back.